Show. I'm your host, Heike Turchiano, and today we'll be discussing two subjects that are probably near and dear to most women's heart, and some guys as well, and that's going to be a discussion on cellulite and varicose veins. Now, there's a lot of misconceptions about what cellulite is, and a lot of people just think it's fat deposits. Okay, I'm overweight. And yes, that's a contributing factor, but when you get that mattressy kind of look, that little dots in it around it, it literally means that you've got fat cells beneath the skin becoming engorged with liquids. The key is to determine why the fat cells are becoming engorged with liquids. And most of that has to do with a collagen protein production problem that binds all these cells together so then the fluids can fill in the spaces between the connective tissues. What causes it? Lots of debate on what the causes are, but primarily what we're looking at is very poor circulation, oftentimes getting to that particular region, be it the hips, the tummy, the arms. Those tend to be the most common areas of where cellulite tends to develop. And it does seem to come along with age, as it appears as though people become less and less active. Overweight is a contributing factor because obviously the more fat you have, the more potential for the spaces between the fat cells. So dropping off the weight is somewhat helpful as well to being able to defeat or conquer the cellulite problem. Nutritional deficiencies, and we're going to discuss some of the things that help down the line, but poor diet, poor supplementation, or the lack of certain types of vitamins and nutrients, the good old potato chip diet or the good old hot dog diet, those are not nutrient-dense foods. And as a result, when you have nutrient-poor foods, everything kind of goes, including the connective tissue in the skin and around your cellulite. So what helps? And that's what we're after here anyway. Ester C, or esterified vitamin C, which is a fat-soluble vitamin C, with bioflavonoids. That combination together really helps the collagen protein matrix to reassemble itself so you don't have those little puckers in between. And I've got a dosage here of 1,000, 2,000 milligrams twice a day because most of the research supports you need higher dosages. And the ester Cs, unlike ascorbic acid, if you took that higher dosage in ascorbic acid, it would give you a diarrhea. And that's obviously something we want to avoid while we're getting rid of our collagen. An herb called Gutacola, real good research for collagen matrix in combination with vitamin C with bioflavonoids, has been shown in about a 500 milligram twice a day dosage. If you're consistent, will help reduce the collagen. Things that can help increase circulation to the area and increase metabolism. Horse chestnut capsules and cream, actually topical applications of the area, really help to get rid of that mattress look type of phenomenon that you get with that cellulite. Kelp increases the metabolism, and there's certain iodine sources which also help with thyroid as well. Obviously, you don't want to do excessive amounts of kelp, particularly if you're on a thyroid medication, but you require a minimum of 150 micrograms of iodine. So kelp is a good source of iodines. It's a natural form that easily absorbs in the body that can help with metabolism. Exercise. Just about every lecture I give says exercise, 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 and it seems to be with blood pressure, cholesterol, whatever it be. Exercise is paramount. It's very, very important as part of getting circulation into the area. 30 minutes a day, very little to ask, and there's some good statistical data that says for every hour you put in of exercise, you get 2 more hours of life out of it. So out of your body. So, and you have more energy and you feel better. But as far as cellulite is concerned, getting the circulation in there, burning off some of the fat, getting the blood supply in that area helps with cellulite and a reduction of cellulite. Lipomassage. I know we have a massage therapist, Bobby Kinner, that works for us at one of our stores, and she uses lipomassage. It's a technique that's taught to and there's even actually a certification for lipomassage, and where they literally massage the area, get the circulation to that area, and she's seen, as well as other massage therapists I've spoken to, reduction in cellulite. That's just another way to get circulation into the area and get things flowing and moving. very brief. It takes very, very little to work on cellulite. But if you're consistent, based upon what I've got down on here, and then obviously whatever other research you do, if you're consistent with it, it will definitely, definitely help you reduce, if not get rid of your cellulite. We're going to move on now to the varicose veins issue. Okay, what are varicose veins? Abnormally enlarged, bulging, bluish, lumpy-looking types of veins. You're going to see them mostly on the ladies' legs or guys' legs too, and they kind of stick out. They got kind of nagging, throbbing pain to them. They literally hurt. And what this is caused by, what causes it, is unlike the arteries, the veins have little valves in them that keep the blood from backing up into the veins. So these veins start to malfunction and they don't seem to be able, and they break down, they don't seem to be able to properly let the blood out. And so you'll get the swelling of the veins and they get inflamed and hardened. Overweight, lack of exercise, and genetics are probably one of the biggest contributing factors to varicose veins. Just not moving or standing in one particular place for a long time. Having a lot of pressure where you're not getting any movement and circulation going. Pregnancy or a real drastic weight gain can also contribute because you have a lot more weight and a lot more pressure going on the lower extremities of the body. Hormone replacement therapy and birth control pills can contribute as well to varicose veins. Constipation, heart failure, liver disease, all various elements that you can kind of go back and say, circulation is involved with this. So if your blood pressure is high, you're not getting good circulation. Kidneys, all of that involve a good circulatory system. And obviously, if the veins the vein valves are not working properly, it's going to reflect itself in these items as well, too. A deficiency in vitamin C and bioflavonoids. I call it a form of scurvy, to be honest with you. I think this 60 milligram to keep you from getting scurvy, excellent to keep you from getting scurvy, but to be healthy, the body requires a lot more vitamin C with bioflavonoids. 75 years ago, from what I'm reading, a tomato, good juicy tomato, had 500 milligrams of a calcium ascorbate vitamin C. Now you're lucky if you got 25. It's because the nature of our farming is such that we use a lot of chemical fertilizers. We don't have these minerals going back into the soil in which the fruit and the vegetables manufacture high levels of vitamin C. So we end up very vitamin C deficient. So when they say you can get it from your food, maybe if we moved back 75 years ago, yeah. Now, no way. It ain't going to happen. It's just not there. Organics can be helpful, but once again, it depends on the type of organic farming you're dealing with as to whether or not they're putting these minerals back into the soil so that the fruit and vegetables can be manufactured or come through into the fruit and vegetables. What helps? Kind of interesting, we see that little ester C with bioflavonoids again for varicose veins. We were talking about it on our when you're talking about cellulite. Once again, the veins need to maintain vascular flexibility. And when the collagen matrix gets hardened, and this goes blood pressure and other kidney circulatory issues, when they get hardened, nothing flows through. They don't move, they just swell. So the vitamin C with bioflavonoids increases the collagen matrix, okay? And it also reduces the blood clotting and increases circulation. So these two, kind of very, very vital if you have the cellulite we discussed before, or if you have, bottom line, varicose veins or any kind of circulatory issues. CoQ10 and dimethylglycine, I abbreviated DMG, helps with oxygen utilization. When you can oxygenate and get oxygen flowing through the body, and you get that through exercising, you get that through eating vegetables or superfoods that are very high in greens, they carry oxygen well. CoQ10 and dimethylglycine, or DMG, helps you utilize the oxygen. That's hence why CoQ10 is so doggone good for the heart. But it also helps with the blood vessels and the veins as well. Omega-3, 6, 9 fatty acids, be it fish oil, flax oil, walnuts, almonds, pecans, Whatever you can get to get those good fats in the diet helps reduce inflammation, keeps things flowing in the vascular system, tells the liver, oh, you know, we don't have to produce as much cholesterol here. We're working fine and smooth. Reduces inflammatory issues. Pycnogenol or grapeseed extract. We have a local physician, Dr. Lindbergh, who recommends it whenever his patients are on Coumadin, which is a type of a blood thinner, and it'll lead to all kinds of bruising all over the body, and doing 100 to 200 milligrams of grapeseed extract or pycnogenol helps strengthen the capillaries and the veins and blood vessels. So that's something that you can get to help strengthen them as well. A good multiple high in Bs. Since our food is so nutrient dense nowadays, not. A good multiple high in Bs and good, you know, various trace minerals like zinc, selenium, those types of minerals that are necessary for good, wholesome bone formation, circulation, survival, is necessary, I think, in most ailments that we've reviewed. Bromelain. Bromelain reduces inflammation. It comes from pineapple. It also prevents some of that clotting, that coagulation of blood in one particular spot, because it eats a little fibrin in between those little clotting cells. So it can help reduce inflammation and increase the ability, or the body's ability, to keep the blood flowing, reduce the clotting. Cayenne reduces pain and inflammation. You're thinking, cayenne, a hot pepper? Yeah, cayenne does come in capsules, and it comes in various temperatures, but it increases circulation, and that's why you see a lot of blood pressure formulas that'll actually have cayenne in them. It increases the circulation, and by that as well can reduce your pain and inflammation. So, butcher's broom, ginkgo, gutacola, again, the gutacola we talked about for cellulite, and hawthorn. Once again, very good for lower extremity circulation. A lot of formulas that are leg vein types of formulas include these herbs in them. Mindful that with ginkgo biloba, if you're on any blood thinners, you have to avoid that if you are. Horse chestnut cream. I think we talked about that back on cellulite again. All this is a circulatory issue. Topically applied can reduce pain, reduce inflammation. Simple little inexpensive little horse chestnut cream with no side effects, no nothing. When we're talking about varicose veins, once again, like everything else we seem to have, it's very much influenced with diet. And whenever you can go organic, because the organic does tend to use, the organic fertilizers do tend to be more mineral dense and nutrient dense if properly done. Lots of fruits and vegetables, and avoid refined carbohydrates and saturated heavy meat fats, trans fats, because they cause a lot of vascular inflammation. So we're eating those good walnuts, almonds, pecans, flax oil, even primrose oil, borage oil, fish oils. Reducing inflammation down is paramount, and we're finding that a lot of diseases and disorders are inflammatory related. So if we can reduce the inflammation down, and that includes varicose veins, oh boy, the body just kind of moves along a lot more smoother. 30 to 35 grams of fiber. I'll see, how many people are doing 5 to 6 servings of vegetables and fruit every day? Sometimes. I got to tell you, it's very, very important for adequate amounts of fiber. If you don't do adequate amounts of fruits and vegetables, you don't get fiber and certain phytonutrients that help with oxygenation. So if you're not a good vegetable eater, not good. You're going to want to, there are supplements that you can get that are vegetable powders, and then you're going to be adding in some fibers like psyllium fiber, apple pectin fiber, flax fiber. There's so many different types of fibers that are water-soluble fiber. Wheat bran fiber, bulking fiber, doesn't move things along. The key is you want to keep circulation going. You want to detox when the body uses the veins and arteries to get rid of the stuff and it gets dumped into your bowel. You want to be sure it gets out of the body before it's reabsorbed back in again. Eating garlic, ginger, misspelling there, ginger, onions, pineapple. Those tend to be hotter types of foods. You know, when you eat them, you kind of a little bit of perspiration, and same will go with cayenne. They really can increase circulation and reduce inflammation as well. Something I came across that I wasn't aware of is blackberries and cherries really do help ease and prevention, actually,